Hello YouTube, this is IrishBear76 coming to you. The topic of this video is multiple sclerosis, newly diagnosed. Where do we go from here? When I first got diagnosed with MS, I had no clue what to do. I was referred to a neurologist, and that's the first step. Find a neurologist that you trust. You're the boss. You have the right to pick your own neurologist. They can refer you to whomever, but seeing that your neurologist is going to handle all of your health care from here on out, I would not. You can have a primary care physician if you would like, a family doctor, but your neurologist needs to know anything that happens to you. If you have strep throat, the neurologist needs a call. Anything you start a new antibiotic for something, your neurologist needs to coordinate all your health care, because he is going to be your best friend, or she, if it's a female doctor, will be your best friend. So the first thing is to find a neurologist. Well, I suggest you find a neurologist that is has a specialty in MS. If they do not, make sure that they have access to someone with a someone at a med center, MS med center type of thing, at least to correspond with them. I know my neurologist was very upfront with me and told me MS is not my specialty. I think seizures and headaches and things were his specialty, but he has a colleague that's nationally in the U.S. nationally renowned for his MS research. So he's been very helpful. But that's the most important thing. Getting a neurologist that you trust, that you'll open up with, that you'll be honest with. And then you start to go over drugs. You might hit some chat rooms or websites, and you're new to MS and hear about the CRABS, C-R-A-B-S. The CRABS, it's an acronym that stands for the four first-line drugs that they're using right now as of March 2009. C stands for Copaxone. R stands for Rebif, A stands for Avonex, and B stands for Betaseron. All these drugs are the first line drugs that your neurologist is going to go over with you. Betaseron and Rebif are essentially the same thing. They're both given right under the skin, I think 3 times a week for Betaseron. Betaseron and Rebif essentially do the same thing. Rebif is a higher dose, and the frequency is 3 times a week. When me and my neuro talked, we decided on Rebif because Rebif is the highest dose with the most frequency, and it's really the most aggressive of the beta interferons, so that's what I chose. Avonex is intramuscular once a week, and it's a kind of a low dose, so a lot of it's according to what you can tolerate. I do know with Rebif, and that's the one I'm going to talk about when I say Rebif. If you take Betaseron, it's just a lower dose. If you take Avonex, it's a lower dose given once a week. There are side effects with the beta interferons. The first one is flu symptoms. I'll be honest with you, the flu symptoms from the beta interferons are pretty severe when you first start. You constantly feel like you're coming down with something. You have muscle aches, you feel like you're getting a fever, headache, just malaise, general feeling of you feel poorly. It does subside. After you've been taking them for about a month, 6 weeks, it gets to where you can tolerate them a lot better. I do know that with Rebif, the first 18 months I took it, I had no new lesions on my MRI. It pretty much put my MS in its place. So that's my choice. That's my drug that I picked. You can pick something else. That's the great thing about having your own neurologist and having your own disease. The disease affects everyone differently. All people with MS react to treatments differently, and you're in charge. MS isn't in charge. Your neurologist is not in charge. You are in charge. This is your body. This is your life. This is your chance. This is your life, and your children. And the way I thought about it was that these, my daughter, I want to walk her down the aisle when she gets married, and Rebif's probably going to give me the best chance, so that's why I chose that. That and it's fiber spelled backwards. Just kidding. That's not why I chose it. But the flu symptoms are a big pain in the butt. Some people are afraid of needles, and giving yourself a shot every other day kind of freaks people out. I use the auto injector, even though I give shots for a living. With hurting myself, I thought it's easier just to press a button and let the auto injector do it. So most of them come with injectors. So just make sure a nurse or other healthcare professional shows you what how to do them. And those are the first line drugs. On the horizon, there are other disease modifying drugs that are oral. They have like 3 pills that they're working on that do various things, like working on helping myelin rebuild or helping to modify the immune response in your body. So a lot of good things coming out. The last 10 years for MS has opened up a lot of new research on drugs. So a lot of drugs are coming out on the market, and it may be a thing of the past having to give yourself shots. But right now, as I say, the beta interferons, highest dose you can tolerate the most frequently, is probably your best bet at this time. With the stem cell research now, I know they're opening up embryonic stem cell research, which I think that's really gonna help come up with drugs to help with the MS disease process. Other things I wanted to talk about. If you are taking the beta interferons, it can cause major liver problems. So you need to make sure your neurologist is ordering liver function tests on you. It's not unheard of for your liver enzymes to get out of whack. And you only get one liver, and it's called your liver because you need it to live. So make sure you're having that done quite a bit, like every 6 months at least. Just check your enzymes, see if they're causing any liver damage. Okay, that's the first line drugs. Now I kind of want to talk about homeopathic things that people are using that they're finding are very helpful. Acupuncture. I've heard a lot of people say acupuncture is helpful to them. It won't make your MS any worse, so go ahead, give it a try. Bee sting therapy. It's not been proven to be effective in helping, but some people swear by it. Me personally, I'd rather have a sewer rat jump in my lap and I would pet it before I would let a bee sting me on purpose. I'm scared to death of bees. But, to each their own. Other things like that I have used that have been very helpful. Ginkgo biloba has really helped me. It's for focus, concentration. It's really helped me with some of the side effects you get from MS, where it's hard to concentrate or you lose train of thought, things like that. So Ginkgo biloba has been very helpful for me. One thing you have to watch with that is you can get a bleed in your eye every once in a while, so just be careful. Lots and lots of homeopathic, not cures, but homeopathic disease treating things, and also pharmaceuticals. Depression, there's debate whether depression's caused from the fatigue that MS causes, or if from the depression that MS causes if you get the fatigue. So it's kind of a chicken or egg type of debate, but it goes, be that as it may, that it may be caused by one or another. You need to decide how you're going to handle the fatigue and the depression, and you should start looking at some of the antidepressants on the market. The excitatory neurotransmitters tend to decrease when you have MS, and when I say that I mean like serotonin, norepinephrine, dopamine, things that make you happy or alert or have that feeling of wellness. You can feel it diminishing. There's my time. Part 2's coming up.